There are questions tonight about how insurance companies decide who gets which life-saving procedures.
An I-Team investigation reveals some discrepancies. Hagit Lamore joins us with what she's found. Patients with the same condition getting opposite answers. Hagit?
That's right. You would think if an insurance company approves a specific treatment for some of its patients, it couldn't tell other patients with the same disease that treatment is experimental. Yet that's what two huge insurance companies in our region seem to be doing to some desperate cancer patients.
There he goes.
These are the moments Greg Lester could have missed.
Is that fun?
When doctors diagnosed him with prostate cancer.
In one word, devastation.
Same as Sarah Ward's father, who prefers to stay anonymous.
He's only 57 years old. He's got, a lot of life left in him.
Yeah. Both men shuddered at the complications from traditional surgery and radiation options their doctors presented. Loss of bladder control, erectile dysfunction, colostomy bags. And then they heard about CyberKnife.
The results really have been terrific.
Don't let the name fool you. CyberKnife doesn't cut. Instead of surgery, this is robot-driven, high-dose radiation.
This will move around the patient, treat the cancer, and then once it's done, it stops, the patient goes home. That's all there is to it. No cutting.
Doctors at Columbus CyberKnife say instead of standard radiation's 40 treatments over 2 months, this takes 5 treatments in 1 week. Instead of surgery's risks and recovery time, patients can go from treatment to work. But the part that sold both Cincinnati area men, pinpoint beams spare surrounding normal tissue, minimizing those complications from the older therapies.
Patients have very little in the way of any side effects. It's really much different than conventional radiation therapy because it's so localized.
The FDA found enough evidence to approve CyberKnife 10 years ago for use anywhere in the body. We found cases where all these insurance companies have covered it for prostate cancer.
Once we found out more about it, it was, kind of a no-brainer.
Lester's daughter, Jennifer Haas, came to the same conclusion as Sarah Ward and her dad.
Any guy in his right mind would want this choice.
A choice denied. Humana told Sarah's father no.
It's sad and it's a shame.
Anthem did the same with Greg Lester.
No, it's not fair.
Both companies calling the procedure experimental for prostate cancer.
It doesn't make any sense.
Even though both have paid for it for other prostate cancer patients.
It was awful. They shouldn't be able to get away with that.
The I-Team looked through hundreds of pages of research before calling both insurance companies. We found Humana has covered the procedure for prostate cancer patients on some of its Medicare plans.
Well, here my dad needed them the most, and they fell through. They totally fell through for him.
Anthem's parent company also has covered the procedure on some of its plans, calling it medically necessary and effective for prostate cancer. Take a look at this letter from 2008 from Anthem to the same hospital where Greg Lester sought treatment. CyberKnife is appropriate for the treatment of prostate cancer and is supported in peer-reviewed journals. This therapy fits the definition of good medical practice. Compare that to the letter denying Greg Lester the same year, calling the procedure experimental investigative and saying there is not sufficient scientific data to support CyberKnife to treat prostate cancer.
It's frustrating. It's frustrating when you know that it's a recognized, acceptable treatment and they keep telling you that it's not.
The I-Team found study after study about the procedure used for prostate cancer, including this one showing 5-year outcomes with fewer side effects, notably shorter treatment, more immediate return to normal daily routines, and potentially reduced health care costs. That's the part that gets both families who appealed their denials.
It's actually less expensive than all the other treatment options, which is mind-boggling that they wouldn't cover it. They're essentially driving up the cost of health care, which is a real problem in our country.
That's right. The cost of CyberKnife has dropped significantly from $150,000 when Greg Lester sought permission 2.5 years ago to $35,000 this year when Sarah's father needed treatment. But less expensive still costs.
Where are we going?
Greg Lester was diagnosed 8 months shy of 65 years old when Medicare would kick in with full coverage for CyberKnife.
Dr. Grimm said, why don't you wait 8 months and the bill will be paid for? And I said, well, if something was attacking you, would you wait 8 months?
He traveled to the nearest CyberKnife center in Lexington and paid out of pocket, but continued his appeals. 2 weeks ago, Anthem mailed his hospital a check, saying they would make an exception in his case alone.
I just think that ultimately they need to change their policy so other people don't have to go through it.
For now, the policy remains for both companies. Sarah Ward's father still is fighting Humana. Its spokesman tells us, despite the studies we found, Humana only recognizes treatments approved in Tier 1 medical journals. Anthem also calls CyberKnife an emerging technology. Both companies say exceptions don't redefine their policies. And they had a lot more to say, and we posted all of that at WCPO.com. Clyde.
All right, Hagit, interesting reporting there.